Well, a warm welcome to this talk. It's Saturday the 4th of September, and as you might have gathered, I'm working out of town at the moment, and this may or may not work. I'm going to try and improve the technology for tomorrow, but if you want to bear with it, there's some rather interesting things to talk about, actually. That's why I wanted to do this. Now, I've had lots and lots of questions about this Delta Plus variant, first identified in India in 2020. But now India and the Europeans have both authorised this, or sort of recognised it as a variant of concern. Now, this has got all the normal mutations that the Delta variant's got, but it's also got another one called K417N. So this is an additional mutation. Now, I'm sorry I can't show it to you on this technology, but it means on the 417th position, the 417th amino acid on the spike protein, the K amino acid, is changed into an N amino acid. Now, some people in India are saying this makes it more transmissible, more easy to bind to lung cells, potentially resistant to monoclonal antibody therapy. But I'm not going to comment too much on this now, because basically we don't know a lot of these things yet. This data is very uncertain. So keeping an eye on this Delta Plus variant, of course, but I'm not really too concerned about it at the moment. I mean, given that it does seem to have been around in India for a while, it has spread around India. It's also been identified in the US, UK, Portugal, Switzerland, Japan, Poland, Nepal, Russia and China, which sounds bad, but it's not widely spread as far as we know. So we're not overly concerned about that at the moment, but we are going to keep an eye on it, of course. Now, the other thing I wanted to talk about today is long COVID and vaccination. Now, of course, as always, I'll put all the links, all the text I normally scribble on is all going to be there in the description. So you can still look at it, you can still check my references, make sure this is accurate information. Now, this information on long COVID and vaccination comes from the Zoe Symptom Tracker app, but it was published today in Lancet Infectious Diseases. So been peer reviewed already, and it shows some things that are good and some things that are a bit concerning. Now, people that are doubly vaccinated, 31% less likely to experience acute COVID symptoms. Okay, that doesn't sound like a massive reduction. 47% less likely to get long COVID if they become infected. So basically, it means they can still get long COVID if they become infected, and there's only a 40% reduction in that. So that's not too good. And again, if they do become infected, a 73% reduction in hospitalisation. So that doesn't sound good. But there's some better news in a minute when Tim Spector clarifies things. Now, the most common symptoms do seem to have changed somewhat, which is quite interesting. The most common symptoms now seem to be much more similar to unvaccinated adults, with the anosmia, the loss of smell, cough, fever, headaches and fatigue. And the symptom that people are getting when they're doubly vaccinated that they're not getting when they're unvaccinated is sneezing. So sneezing seems to be the one now that's unique to people that are vaccinated. It's a bit of a shift in thinking there from the COVID Symptom Tracker app, really. So that's quite important to take on board. So the anosmia, the loss of smell, the cough, the fever, the headaches and the fatigue can still occur in the people that have been doubly vaccinated who get infected. So Tim Spector does clarify this, the lead author of not the lead author, but the lead of the study. He said vaccinations are massively reducing the chances of people getting long COVID in two ways. Now, this is where the better news comes in. He says, firstly, by reducing the risk of any symptoms by 8 to 10 fold. So you're 8 to 10 times less likely to get the virus in the first place. And if you do get it, you're about 50%, 47% less likely. So altogether, it is quite a good level of protection because you're 8 to 10 times less likely to get it in the first place, which is the reassuring part. So first, by reducing the risk of any symptoms by 8 to 10 fold, he says, and then by halving the chances of any infection turning into long COVID if it does happen. And we're encouraging people to get their second jab as soon as they can, according to Tim Spector. Now, Sajid Javid is weighed in on this, the Secretary of Health, of course. COVID-19 vaccines have saved more than 105,000 lives, Mr. Javid is saying, which of course is great, and prevented 24 million infections in England and Wales alone. So that's what his authorities are telling him. This research is encouraging, suggested vaccines are not only preventing deaths, but could also help prevent some of the longer lasting symptoms. 80 long COVID assessment service centres have been set up in the UK. So Sajid Javid, they're clearly being quite optimistic about the vaccination and talking it up, and I agree with him. He said it's clear that vaccines are building a wall of defence against the virus and are the best way to protect people from serious illness. So that is from Sajid Javid. So there we go. Quite a big reduction in the probability of getting long COVID overall, if only a 47% protection against getting long COVID if you are actually infected. Now, the other thing I wanted to mention today, I can't show you any graphs at the moment, but it's a pity. I did have some interesting ones. Israel, for example, the number of cases have shot up quite dramatically, but hospitalisations haven't. Hospitalisations are still a lot lower than in the US, which is encouraging due to the vaccination rate and the fact that Israel is now starting to roll out a booster dose, which is another interesting development that other countries haven't taken up yet. But just briefly, Australia, Scott Morrison Prime Minister, basically this is a big culture change in Australia. So time to leave lockdowns, he's saying. Come out of the cave and live with the virus. So this is a dramatic change in Australia. Because of course we were talking about Fortress Australia or COVID zero situation in Australia. For example, Melbourne has had 200 days of lockdown over the past 2 years. They've had a difficult time there. So the situation in Australia now is Australia's vaccinating quickly, which is good. All people over 12 years are getting it, which we could argue about. That hasn't happened in the UK as far as I'm aware yet, unless I've missed some news today. They're going to ease out of lockdown in Australia, not to jump out of it, which is probably a good idea. They're learning from the mistakes that may well have been made in the UK. Vaccinated people are going to get more freedoms in Australia, so there's definitely going to be some things that vaccinated people can do that unvaccinated can't. They're going to continue testing and tracing, which is good. They're going to retain low-level restrictions like mask wearing and social distancing. And they're talking about opening the borders when they get to 80% of people doubly vaccinated. Now, the big problem with Australia's thinking here is the vaccination programme. Although it's going quickly, the vaccination levels are way, way lower than the UK and Europe. So they've got a bit to go yet. And let's hope they don't start easing out too soon. But a definite culture change there in Australia. So they're not going for a Freedom Day. They're just going to open up gradually is the plan in Australia. And they predict on the Australian models, the modelling, that between 13 and 1,500 people will die in the next 6 months as a result of this change in philosophy, which is quite sobering really when you think about it in terms of lives like that. So I think we'll leave that for today, just a brief update. Hopefully we'll have a bit more technology tomorrow. We'll see how we go, but things are difficult when you're on the road, and thank you for watching.